South East Integrated Care team involves a number of different specialities and actually organisations. So we've got Mid-York staff, including therapists, physios and occupational therapists. We've got the nursing staff and the matron staff, nurse and healthcare support worker, and myself, all from Mid-Yorks. And then we've got other external organisations brought in with the Age UK support workers, with workers from Carers Wakefield and also social services. So there's a bit of everything in there.
The average age of people we support in the community is 87, so it's quite some age. And for some people historically, they may have had a short illness, a urinary tract infection or something like that, which would have meant them being admitted into hospital. And what we've done is created a situation, an integrated situation, where we work together as a group of professionals to avoid that happening.
One of the main changes we've made is bringing the whole team together, so we're all now working from the same office. That enables us to work as a coordination team as a whole, and we can deal with each person as an individual on the spot immediately.
We've really gelled as a team and sort of found how joint working can really benefit patients.
It gives us quicker access to services with us all being in the same room, and we also have faster access and faster response times for each patient.
Patients can self-refer. It's usually GPs or hospitals or the district nursing services. Also we get the internal refers from social workers, from therapists, where we can refer to them as well. It's a complete service, and we have a lot more time to give them more of a holistic treatment.
One example I'd like to use is where an old lady in her mid-80s was visited by a GP on an evening. She was clearly off her feet, and the doctor had diagnosed the urinary tract infection. Now historically she would have gone into hospital, but on this particular occasion we were able to admit her into one of our respite beds in one of the local authority homes, and she had the right medication, and it resulted in 3 or 4 days later being able to go home and her situation stabilised. When you see success cases like that, that's rewarding, and it reinforces what we're about.
The new setup, it really improves patient care purely because instead of having a 6 weeks waiting list for certain services, we can respond within the day. In some occasions we can even respond within 2 hours, which has obviously just increased that responsiveness by tenfold really.
I think it's really important to do joint working with people. I found it very beneficial for speed of treatment really. So I've visited patients and I've sort of looked at their medication, but I think there's an issue with their blood pressure. I can get one of our team to go out and sort that out straight away without having to make a referral to another organisation. I've worked quite closely with some of the therapists trying to work on analgesic control so that they can enable patients to get the best out of their therapy, and again without having to wait for external referrals.
I think it's imperative for organisations to work together, being on site with each other and having those conversations in real time rather than having to pick up a phone or email a colleague, and that can only benefit the client.
If you're going in with another person jointly, you're not bombarding a patient with lots of different visits and lots of different phases.
I think it's wonderful. Personally, I think everywhere and everybody in the country should be doing this.
It's just speeding up the whole process and giving patients a one-stop shop.
What's rewarding for me is to see health, local authority and voluntary sector colleagues working together in a common goal.